All right, well, welcome everyone. We will have some folks kind of trickling in, but we will go ahead and get started. So good afternoon, and again, welcome. My name is Kara Downey, and I am the Director of Program and Health Equity here at the Cancer Support Community. We are so incredibly grateful to have you all here today for our Community Health Worker Peer Support Forum on screening for cancer caregivers with our expert speaker, Tone Mirás Neira. So this forum is actually part of CSC's larger CHW oncology-focused training program. And that program also features other resources and supports for CHWs working with anyone impacted by cancer, including a series of quick guides in both English and Spanish on important topics in oncology navigation. And just for housekeeping reasons, so both a recording of this forum as well as our past forums and those quick guides are available on our CHW website. And then Lizzie will put that link in the chat for everyone as well. And then, so for those of you who are joining us for the first time, I'll just give a little brief introduction on the cancer support community. And so for more than 40 years, CSC has been relentless allies for anyone impacted by cancer. We help individuals manage the realities of this disruptive disease and get back to their version of normal. Whether you're accessing our free services in person at one of our 196 locations across the country, online, or via our toll-free cancer support helpline, you are getting a team of licensed professionals providing patient navigation, financial counseling, genetic counseling, pediatric support, and more. And so now, without further ado, I would love to officially welcome our guest speaker, Tone Mirás Neira, and I'll give a lovely bio for him, and then he will get started on the presentation. So Tone was born and raised in Galicia, Spain, and studied sign language interpretation at the Universidad de Vigo, specializing in psychosociology of the deaf community and interpretation for the deaf-blind. Additionally, Tone taught nonverbal communication and body expression in collaboration with their dramatic arts department. In 2012, Tone moved to the US and began working as a CHW with Casey Care Health Center. Since then, Tone has supervised different CHW teams and created various programs at a national level. Tone has co-chaired the Kansas Coalition for CHWs for the past 3 years, promoting education and networking among CHWs statewide. Currently, he's the project manager of the COPE project at the University of Kansas Medical Center, in which he oversees over 60 CHWs across 20 counties in Kansas. He has developed and taught CHW and supervisory pragmatic training and co-designed a database to track CHW outcomes and successes. In addition to his professional work, Tone is a graduate student in the Master of Public Health program at KUMC. And currently, Tone is also working at both a national and international level to assist community organizations, clinics, and hospitals in developing tailored CHW programs that meet their specific needs and to serve their populations effectively. So welcome, Tone. That was an incredibly impressive bio. We are so happy to have you here and for you to bring your, really immense wisdom to our attendees. So I will hand it over to you then.
Sarah, thank you so much. And thank you, everybody, for having me for the second time. This is the second time on the second year that I'm presenting. And last year, we were talking a little bit about being a community health worker and working specifically with patients who have cancer and the struggles as community health workers that we have when we are working with a population that really needs the help of a CHW. So Today, we are going to be talking a little bit more about a topic that is very important for community health workers, which is we not only work with the clients that we serve or the patients, but also with their families. So a little bit more about me. When I started to work as a community health worker here in Kansas, um, I didn't have any specific training. So my training was basically a list of patients given to me, and my supervisor at that time said, figure out what's going on with them. So we took it upon ourselves to make sure that every single CHW has the correct training. We don't want to throw people to the wolves out there without having a training on how to, work with families, work with clients that you serve on a daily basis. On my first role, I started working as a community health worker within the emergency room of a hospital. And soon enough, I built trust with the providers, and I was getting patients that were like very like high needs, like patients who needed to attend dialysis, but also patients that had cancer. And that is where I started my story on working with patients with cancer. Not only one hospital, but there was another hospital on the Missouri side that will begin to send me referrals. And soon enough, I got engaged with the cancer center. Um, at that point, to be honest, my experience with cancer was basically with my family. We have a huge high rate of cancer in my family, and some of us survived. Some of my family members didn't survive. But this helped me out to understand how to better serve the patients that I'm facing, but also their families. And so, before we start, we have some disclaimers. The information in this presentation is for educational purposes only. It is not intended to replace any medical advice, diagnosis, or treatment. The patients and families should always consult with their healthcare providers for questions about their health and treatment options. And the role of the community health worker is to provide support, education, and connection to resources, not to serve as a medical professional. And probably for all of you guys who are community health workers, you already know that, but it's just a reminder. So without any further ado, let's just get started. When we talk about community health workers working in the cancer field or in the cancer care, this is very important because at the end of the day, our role is going to be helping the clients or the patients, as you guys call it, and their families to get to a good end, to have a good understanding of how to navigate the system. So we are, as community health workers, helping the families to understand cancer and the cancer plans. When a family, and I'm going to be putting examples, but when a family member deals with cancer and for the first time is diagnosed, they get to the cancer center, they get the diagnosis, and it feels like a sentence. And then it's very difficult for them to understand what the next steps are. I have worked with clients that, and I apologize, I keep calling them clients, that's how they call them here. I've been working with clients that the reality of them is that they didn't have any support system, any family. And right in there, after they get the diagnosis, somebody else comes in the room and they are already telling them, like, here are the next steps that you're going to have to do. You're going to have to go through this procedure. You're going to have to go to the counter here. And they are still stuck on the idea, oh my gosh, I got diagnosed with cancer. And sometimes that can be very challenging and it takes time for them to process. So as community health workers, we are there to hold their hands and to just help them out to make sure that they understand what the process here is, but also to mediate between the professionals that are dealing with the client and their families, and also ultimately the client and the family as well. So as community health workers, of course, we provide emotional support during uncertain outcomes. We support the caregivers with navigating appointments, treatments, follow-ups, and also we bridge the communication between the oncology teams and the families, as I mentioned before. And one of the things that to me was very important is to normalize the discussions about family risk and preventive screening. Um, I will say that in my family, if we knew that our cancer was genetic, probably some of my relatives will still be here. Unfortunately, we didn't do it. And at that time, I was a kid, and probably there were not the advances that we have right now. But that is a great opportunity that as community health workers we have nowadays, and as health systems as well, right? So why is it important to screen the caregivers? As I mentioned right now, there are many of the cancers that are hereditary, and there is a history of cancer. And sometimes making sure that uh, we do that screening is gonna save lives, or it's gonna prevent, a cancer to metastasize. So the family history increases the cancer risk, and that's a fact. And as community health workers, if we don't know that, we need to know it, and we need to convey that to the families that we are working with. And sometimes it's not, and we will talk about this here in a second, but sometimes it's not easy to have these conversations with the families when they are dealing with a loved one who actually has been diagnosed with cancer. They tend to focus on the person and not on themselves, so as family members. So the caregivers have lower screening rates. And I don't know if Kara might have this information here, but here in Kansas, we have a 30% of screening rates for family members of somebody who had cancer. Um, it should be much higher than that. The caregivers often neglect their own health. They they put themselves into helping the family member with cancer. They are going to be doing everything that is possible, and they are not going to acknowledge what they're going through. They are not going to acknowledge their mental health. Uh, Sometimes they are not sleeping because they are thinking about what's going on with their family member. And sometimes that's a challenge. And sure enough, they're not going to do a screening because that's the last thing that they are thinking about. And that ties with what I mentioned: the stress, the grief, and fatigue delay that preventive care. Grief is a big piece. I will tell you that I've been working with several families, and families who has lost somebody to cancer, and they have to cope with it, and that takes time. And it is very, very difficult to bring up the screenings when it comes to that moment, and you're talking to that family member who just lost a loved one, and they just don't know. They don't want to even know anything else about it. It's like, okay, this person passed away. That was my family. I just don't want to know anything about cancer. I don't. I want to disconnect. And as much as we can respect that, that's an option that we got to put down on the table for them to consider. So when to introduce the conversation, I always say this to my community health workers: it's never too late. It's never too late. Even when the patient, or if the patient passed away, it is important that we still have an opportunity to talk to that family member or family members about the potential option of screening. But you can do it on the intake stage. And so this is basically when you do an assessment at the very beginning. A patient has been referred to you. The patient might have any kind of cancer, breast cancer, and you are talking to the patient, and sometimes obviously you're going to have to ask the patient for consent to talk to the family as well, or if they are going to be included on the care team. If that is the case, then that is a great opportunity for you to assess not just the general needs, the social and medical needs, but also ensuring that questions about screening are done. And we are going to be talking about that here in a second as well. When there is a treatment milestone, when there is remission, when chemo is not working or radiation is not working, and then you just gotta have those conversations at some point. So this is a reason for you to just go back to the family. And normally you have one or two contacts. You're not gonna have a whole family that you're going to be contacting with, but you're going to have a representative of the family member that you're treating with. If there is a recurrence and if there is a completion as well. When there is bereavement, and I kind of mentioned this before, just, a gentle touch on the shoulder, talking to them and following up with them on like, I'm sorry for your loss and giving them time to cope and everything. But at some point, you just gotta do a follow-up on that and ask, is this a good moment to talk about this? Always just making sure that we are asked for consent to have those conversations. In my experience, I had situations where some of the clients were open to have a conversation, and some of the clients right in there disengaged from the services. They thought that it was inappropriate to receive that question. But it is very important to ask it. So, but how do we do it? Because that is a tough conversation, to be honest, right? So, whether the person has been diagnosed or whether the patient uh, just recently passed away and you're talking to their family, in any of these situations, it's never easy to have a conversation about like, hey, I know that you lost this person so much, this family member so much, but how about yourself? And how are you feeling right now? And have you tested? So, as community health worker, probably many of you went through the motivational interviewing training. Um, if you haven't, I really highly encourage you to do it. Um, that is going to tilt the balance on those conversations when somebody has ambiguous feelings about taking an action or not, like quitting smoking or any other, stop drinking. The motivational interviewing is not pushing somebody to do something that they don't want to do it. It's having conversations where they can reflect on their own actions and on their own steps to decide by themselves the next steps that they need to take. And that is done through motivational interviewing. Um, Secondly, you have to empathize with the clients. If you are somebody that has lost a family member or a loved one to cancer, you know how that conversation looks like. And picture that moment of your life and how would you like to be approached by somebody? And if you haven't lost anyone to cancer, that is exactly the same situation. You just can picture yourself in thinking about how would I like somebody to approach me to ask a question like this. So before you ask a question point blank, it is important to think what you're going to say, when you're going to say it, and where you're going to say it. I always tell my community health workers to try not to have these conversations on a waiting room where there is more people in there, or even if there are like multiple family members, because you might get divided opinions about testing. All right, so screening for any kind of cancer. So frame the screening as self-care and family responsibility. You can you can start with questions about their health, how they're coping, acknowledging, I know that you haven't been sleeping lately and and you might be tired. How is your health? And then from there, beginning to ask more specific questions. Is this cancer something that happened in your family? And try not to push, that's for sure. I have seen CHWs who was like, well, you need to do this. And that is a client that is going to shut down. They're, the more that we push, the less that they're going to be receptive on that. And then I used to work a lot with the Latino families here in Kansas, and the family responsibility was something that was very important for them. When you talk about somebody who has any type of cancer, and you talk to their families and you say, it is important that you do the screening, because at the end of the day, you are the pivot or the pillar of this family, and it's important that you are also here for others. And that is something, the family responsibility is something that, especially in the Latino families, have been uh, the piece that tilts the balance towards like doing the screening. For sure, as I mentioned, avoid any kind of blame or guilt, like, well, if they did that before, probably we wouldn't be in this situation. Anything that like that is not helpful, and it's going to create a breach between you and your client and the family members. So try to avoid that. And then celebrate the small steps. I'm just going to say something else before that. One of the things that is important is that if you know that you're going to have that conversation, make sure that you're already bringing information about the screenings. You might bring flyers, you might bring written information. I don't care, even if it is information that you wrote in a paper. But something that you shouldn't be doing is getting there, talking about the option of screening, and you got that family member engaged, and they're like, okay, fine, we're going to do it. And then you don't have that information. It is important that you can convey it right in there, because at that moment, family members can be very volatile and they can change their mind in a heartbeat. So you might be talking to them and they say, yes, let's do this. And it's, oh, you know what? I don't have the information here. Let me call you tomorrow. And the next day you talk to them on the phone. It's like, on a second thought, I just don't think I want to do it because I'm afraid that I'm going to find out. And that is one of the main reasons that they are telling you, what if I have it? And so, um, as community health workers, if you did role playing, I seriously challenge you to do a role playing on this, on having a conversation with maybe another community health worker, and seeing how that conversation goes, and provide feedback to each other. But it is very important to be ready to have these conversations when the moment comes, because at the end of the day, if you're not ready to have the conversation and the family member is not ready to have this conversation, you don't want to get into a situation where, this is swept under the carpet and then we move on. Okay. I'm just going to say something else on that before I move on. When I was working as a CHW, and I was already 3 years into working as a CHW, there was this patient of mine. He's Latino and he got a thyroid cancer. And so it was a very challenging situation because he didn't have any kind of health insurance. His citizenship status was irregulated. And he wasn't able to go through all the process. And that's why he was referred to a community health worker, and we helped him out with all the needs that he had, including getting chemo, etc. But the family members, when I talked to them, I had that initial conversation, they were not open to it. And they were like, no, we didn't have any cases in the past in our life. And I'm talking about siblings. And so it wasn't until like the third day that I was interacting with the family and I talked to the mom for the first time. And the mom was like, we have several cases in our family. And so it was using the mom as an ally to be able to convince other family members to do the screening. So keep that in consideration as well, that sometimes if you're working with more than one family member, the first one might not want to do it, but the second one might have not only the decision of making it, but also the decision of convincing somebody else on the family to get screened. So one of the ways to do this, I was talking about the intake assessment. you can do this when you do your social determinants of health assessment. And I hope that's the case, that when you get a client referred to you, that you are assessing their needs, medical and social needs, and just helping them out by developing a plan. So when you put it within the assessment itself, you're just normalizing the situation. It's another question that you're going to ask. And of course, you're going to lean more into that question and ask further questions about it. But it is important to ask it in that moment. If this is the moment where the client has been referred to you. If it is later on, and let's say that you're working with Mr. Smith. Mr. Smith has been diagnosed with cancer. You have been working with him for like 2 months, and he is receiving radiation. And then all of a sudden, a family member just comes in, and you begin to have that conversation with the family member. So you could, if your organization allows you to do this, and here our providers always encourage that the community health worker will do an assessment not only with the patient that has cancer, but also with the family members. So right in there is the moment to do and to ask that question. Have you been screening yourself regularly for this type of cancer? And that might be helpful for the family member, and sure enough for you as well. You will be able to provide the resources and the connections that they need. So when you start with the assessment, and probably this is nothing new to you, so my apologies in advance for preaching to the choir here, but explaining how the assessment will touch on social and medical barriers. You get to the family member and make it as plain as possible, like plain language, saying, I'm going to be asking you some questions just to find out, what are the needs that you have beyond your family member, and see how can I help you. And then stating that you are going to assess social needs and medical needs. You can put examples in there like transportation, food. And then when you talk about medical needs, you can say, I'm going to ask you questions about your health. And there is when you are going to ask questions about the screening. So questions that you can ask are simply questions like, when was the last time that you did a mammogram or a colonoscopy? And that is a pretty straightforward question that you can ask. It is important that you do open-ended questions. I see a huge difference between saying, do you have a mammogram? And then you get a yes, no response versus when was the last time? Because if they haven't done it ever, they're going to tell you, well, I haven't done it ever in my life. Or if they haven't done it and there was a reason for it, probably they're going to tell you, I tried to do it. I was going to do my mammogram, but, through the health system, I got lost in translation with all the steps that I had to do, and I got lost. I wasn't able to do it. So that is giving you great information on how you can help actually that client. Okay. And then beyond that, identify the barriers that the client might have for that screening. Maybe transportation, family members that are homebound beyond the person who has cancer, right? Their family members, or there might be somebody who is in a wheelchair and might not be able to make it there, or they cannot afford the test. They don't have insurance. They don't have a social security number, and they are afraid to go to a hospital. So you, as the community health worker, are going to be the one who can bridge that gap and just make sure that they get all the means that they need to be able to do that testing. Um, Normally, when I train community health workers, I talk about two roles of the CHW. One is the support role, and this is the one that we're going to be talking about right now. And the second one is the empowerment role. Okay. So as a community health worker, you are going to be doing your regular job, like working with the patient and also working with their family, which is advocating for them in clinical settings and social settings as well. I will tell you countless times where I've been working with clients, and most of the clients, I have to also express this, most of the clients with cancer that have been referred to me and my team, they either are uninsured or underinsured. So that is no insurance at all, or they might have just Medicaid. And especially if you are in a state that Medicaid is not expanded, might be more even challenging to connect them to resources, not connect them to resources, but to get them access to the resources within the clinical site that they might need. So when prescriptions are given to the patients right in there, that you are able to have a conversation and saying, I don't think my patient is going to be able to afford that medication. Can you prescribe a generic, or is there any kind of like prescription assistance program that that we can utilize for this client so they don't have to pay as much for the medication? And then same thing for the family members. I will tell you, in not all the community health workers have to do this or are allowed to do this, but when a patient is undergoing surgery for a cancer removal and the family is there in the waiting room, I had CHWs that they say, I want to be there. I want to be there with the family members because we know, and it's not all the cases, but some of them, their health literacy is not quite there. And for them to hear terminology that might be a high level, they're not going to understand it. They're going to be nodding, but the reality is that they are not understanding, especially post-surgery when there is like a care plan and the family member is assigned tasks that they are supposed to be doing to take care of the loved one. So the community health worker is that kind of liaison right in there. And that ties in with education in plain language, right? So countless times I had to tell the doctor or the nurse, like, can you please, rephrase what you just said? I feel like my client is not understanding. And they do. I mean, they are happy to do it. They just assume, and sometimes assuming is not the best option in there. And then connecting to resources, as I mentioned before, to transport, for financial aid, support groups. I had situations in one of the hospitals in Missouri where somebody had to have a second surgery. This was after a cancer removal, and there was a second surgery that was not life-threatening. And this client got in there after being scheduled for the second surgery. And right in there, they said, well, you have to pay out of pocket $500. And the client, he couldn't believe it. He was like, well, I don't have $500. And so as a community health worker, to be able to mediate between the financial department is like, is there anything that you can do? I mean, this surgery needs to be happening sooner rather than later. If not, this client is going to come through the emergency room. This is going to be more expensive. It's going to cost more expenses to the hospital. And sometimes you have to speak that language, unfortunately. But just having those conversations to advocate for the client in terms of financial aid. And then support groups. Most of the times that I connected a client to support groups was when a family member passed away. And just being able to talk to somebody else, and just not support groups, but also counseling and grieving therapy as well, which is the next one, informal counseling and emotional support. And then the accountability, like the general reminders for screenings is very important. Not just for the screenings, for everything, right? So if they are going to have appointments, ongoing appointments, it's just good that as a community health worker, you just give them a general poke on the shoulder and say, hey, remember, tomorrow you have your appointment. Do you want me to go with you? What do you need? Do you have transportation scheduled? And things like that. But for the screenings specifically, it is also very important. The screenings might be scheduled, and between the time that the screening is scheduled to the time that you actually have to go to that appointment, it's important that the CHW have those conversations with the family members, reminding them, hey, you're going to have your screening. How are you feeling about this? And empowering them to do that. And then for the care plan follow-up, this is what I was mentioning before, when somebody might have had a cancer removal, and then the family member is going to have to follow up with appointments, etc., to help them out with that. But also, if somebody went through the screening and they say, hey, you are at high risk, or, unfortunately, we have discovered that you have something and we would like to do further test, that you help that family member with the follow-ups. I will also say this because I found it in the past where some organizations would not allow the CSW to work with the family members, um, which I think it is counterproductive. I think that as much as you can have the CSW working with the care team, and the care team includes the family members, is just very important. Only if the client agrees to, or the patient who has the cancer in this case. This is the second part of the role that I was talking about. So the first one is supporting them, going with them to medical appointments, giving them resources. But community health workers, we cannot hold on to a caseload and keep going with the same patients always, because you are going to get new patients. And the idea is to prevent that dependency on us as community health workers, and also to promote self-sufficiency, that they know, the patients and their family members, how to do those things on their own without having to depend on or rely on us for everything, right? So just to give you an example, uh, there is, I'm trying to remember the name, there is a service that will provide transportation for patients who have cancer. Um, just to give you an idea, somebody might be coming to a hospital here in the KC Metro. That person has cancer. They will remove the cancer, but then they will say, well, we are not going to be able to provide the chemo or radiation. So that chemo or radiation, the patient might have to travel 200 miles to get there. And so there are services that are going to be able to help that client. So the first time that you schedule that transportation for the client, you might be with them in the room and say, hey, I'm going to do this in front of you so you can see how it looks like. You put it on the speaker. They learn how to do it. And then the second time, you might want to be there or do like a three-way phone call with the patient and the service that provides the transportation. But the client is the one that is doing it, or the family member. You are empowering them to do those things on their own. Kira, was there a question on the
I
chat?
was gonna say, yep, there's a question that popped up around kind of care plan and follow-up plans. So that one of the attendees was wondering if you incorporate goals or kind of examples of goals into those follow-up care plans. And they said, if the patient will have kept the initial appointment and will show signs of improvement to baseline. And so kind of to document the proven methods of CHW support compared to kind of without that.
Yep, absolutely. So I can give you like a broad picture of how the CSWs work in terms of like the care planning. The CSW is going to meet with, I'm just going to say with a family member just to keep it consistent. Let's say that a CSW meets with a family member, and this family member has different barriers. So the first thing that the CSW is going to do is to meet, and they're going to say, I'm going to be asking you some questions. Here are, and they are going to be asking those open-ended questions that I was talking about before. So on each of those questions, specifically those that the client is ambivalent, the CSW might ask right in there, is this something that you want to work on? Is this something that is interesting for you? And then the CSW is going to check on those items that might be something important to work for the family member. Once they finish that assessment, the CSW is going to say, okay, so based on this conversation that we just had, here are some things that you and I can work on together. The CSW is not going to tell the patient, the family member, oh, we need to do this first, or we are going to be doing this second. The CSW is going to put the list in front of the patient or the family member and say, what is the most important thing for you here? And the family member might say, well, I really want to have transportation because at this point we're going to have to go back and forth between the hospital and the home. And I really want to make sure that that happens. So they are going to determine, let's say that there are 6 or 7 items between the CSW and the client and the family member. They're going to determine by order of importance which ones are the first 3. And the reason why I'm saying 3 and not the 6 at the same time is because it becomes overwhelming for the patient, for the family member, and for the CSW to have like so many goals open at the same time. So as they begin to complete those goals, then they are gonna, the CSW is gonna be saying, hey, you also mentioned that you wanted to do the screening. Is this a good time for us to begin to work on that? And so they keep going until all the goals are completed. And at any time, the family member or the patient might say, this came up and I also need help with that. So that's a goal added. So priorities can change. So that's one of the pieces. How we do that on our end, we have developed a system where the community health worker has the assessment. It's a database. The community health worker has the assessment. When they come back to the office after talking to the family member, they're going to enter all the responses on the assessment, and that assessment populates goals. And so those goals will have different statuses, like completed, not completed, in progress, not started. And so we're going to be able to track the impact that the CASW is doing with those clients. There are studies with control and intervention teams where you have folks that didn't have the support of a CASW and folks that did have that support, and what kind of goals have been created. And the study talks about like how somebody who has the support of a CASW gets more advanced, gets more self-sufficiency, they know how to do those things on their end. And then if the situation happens again, they remember how to do it. So that's important. I hope that responds the question. If not, please just text back on the chat. I'll be happy to expand on that.
No, they said thank you very much. Appreciate it. Thanks, Don.
Awesome. Thank you. So teaching the caregivers how to navigate the health systems, it can be overwhelming. One of the things here in Kansas is we work across the state, and there are like really a lot of like rural areas, people that haven't been exposed to being in a hospital or even in a city, in a big city, and for them it's overwhelming. So having a CAW that is helping the family members to navigate the system, talking about like the financial department, what is the emergency room, what is patient advocacy if something happened, where is the patient going to be moved next to the next room, being able to have conversations with doctors and providers and empowering them to do it versus the CAW taking the lead on that. And that ties in with self-advocacy and self-sufficiency, right? So self-sufficiency, we talked about it. They will be able to do those things on their own. But self-advocacy is to stand up and say, this is happening to my family member or this is happening to me, and I don't think this is right. Where can I go? Where do I like seek help for that? And then provide tools to track appointments. Sometimes it's apps on the phone, sometimes it's a notebook, and most of the times it's a notebook. So community health workers, we have notebooks that are designed already for patients that have to navigate the health system, where they can put, the name of the doctor, when is the next appointment, what are some questions that you want to ask for that next appointment, what is your insurance card number, information like that. And I have been going with patients that they will go to the medical appointment and they take that notebook with them and they get there and it's like, I have a lot of questions, but I'm very nervous right now. So I just wrote them there and the doctor just gets the notebook and they're seeing the questions and they're responding to those questions. And then the client is taking notes on that. So it's not for everybody, but for some of the patients working for the family members. And then support the long-term independence, because as CHWs, we are here, but we never know. Uh, God forbid there is lack of funding, a program ends, the CHWs are no longer there. And what we don't want to do is to cut the program like right in there and say, sorry, I'm not going to be able to help you anymore, right? So from the get-go, making sure that we are promoting that independence for the family members and for the patients. So when we were talking about that assessment and talking about the genetic risks and talking about like when to do a screening, etc., this is kind of more like in detail, like what is the conversation that you want to have with them, right? And normally what I do, and if I assess and I begin to see that they're a little bit open to have the conversation about being screened and everything, I talk about family history. And when I mention that, I begin to talk about like did this kind of cancer happen in your family before? It's not the first time with a family member. I draw a family tree, and I'm just putting the names, and then I'm just putting the kind of cancers that they had in their family. If you have a genetic testing team within your organization or within your hospital, that will be very helpful for them. If you provide them that information, they might be able to tell you, based on what I see here on the family tree, there is a predisposition of cancer and they might be at risk. So having that conversation with the family members and asking whether or not they're willing to do that tree, because it's different to say it than seeing it visually. Is like, oh my gosh, look at how many people in this generation had cancer. And I wasn't even aware of that. Sometimes they don't know, and sometimes they don't even know what kind of cancer, and they get shocked when they see that most of the cancers were similar or the same type of cancer. So that is a step for them to say, well, maybe I should consider doing the screening. Encourage the genetic counseling when appropriate. Many hospitals have research teams that do genetic counseling. I will encourage you to check on your own hospital and ask if they have a genetic counseling department. Is within the cancer center or within the cancer department. I have seen this as something very, very important. They are very professionals. They know what they are doing. They have the right verbiage to talk to the families. So if sometimes, because I have seen this as well, CHWs that might not feel comfortable having that kind of conversation. But if that CHW, even if they are not able to have that conversation, if they are able to say, I'll go with you to this appointment for genetic counseling and they will give you more information, would you be willing to do that? Then you got them in, because then you have the professionals there that are going to be able to work with that family member. And then the shared risk-based screening guidelines. This is like for different types of cancer. There are some guidelines on when do you have to be screened. After 45, you should have a colonoscopy every X amount of time. So maybe sharing that. And there are some links. Kara, probably I'll send them to you, and if you want to send them to the rest of the team as well. But links that gives you guidance on different types of cancer and different types of screenings that they can do and how often and at what age. So that might be helpful as well. And then just making sure that, I have seen this several times, even regardless of somebody with or without cancer or family members of somebody with cancer. But just in general, CAWs are providing a lot of resources to the clients. Sometimes the clients can get overwhelmed. I always tell my CAWs, when you are assessing the needs of the client, please do not provide resources right in there, because the client is going to get overwhelmed. And so that's not necessary. But you got to give them something tangible that they can use as resources for them. And here you see the National Cancer Institute screening guidelines. This is exactly the link that I was talking about, where provides the clients with like, well, I'm 45 years old. My family member had this kind of cancer. Should I be doing a test? Should I be screening myself on this? The cancer support community, and these communities sometimes are led by peers. So folks that already had cancer, family members that supported if, loved ones with cancer, and they provide education. Sometimes they are also professionals, of course, uh, and they also do the caregiver support because it can be very overwhelming, especially if it is a long haul cancer. Uh, it can be a lot to digest for the family member, and it's just very difficult to get into that tunnel and not seeing the end of the tunnel and say, okay, we are getting to an end here. In between, it can be very, very overwhelming. We talked about this before with, grief and depression and anxiety, not able to sleep, not able to rest enough, not able to perform, because at the end of the day, uh, even when a family member has cancer, our lives continue and you have a job or you have to take care of other family members that you also have in your household. So um, reach out, please, and look for local and state cancer coalitions, churches, and other organizations that might help, because you will be surprised of how many resources are out there. And as a CASW, you know how to look resources. So I will encourage you to do that as well. Don't wait until a client tells you or a patient tells you, oh, I have cancer. Be ahead of the curve and begin to look at the resources now, um, and just save them, you know? And then, as I mentioned before, the caregiver wellness program and support groups, I will say luckily, I see a lot of benefit on those groups when they meet in person. I have linked clients of mine, family members of my clients, to groups that are online, and for some people it worked wonders, but for some people they just wanted something that was more in person, that they could interact in a different way. So this is one of the case scenarios that I wanted to talk about. This was a very, very challenging one. It's a CSW of mine. She goes above and beyond with every client, and she's the kind of person that doesn't drop the ball. And so she has been working with a man that has been diagnosed with colorectal cancer. It was advanced, it metastasized, and then she explained, when not when the first diagnosis, because at that time the client wasn't referred to a CASW, but when the cancer metastasized, um, the patient was referred to the CASW, to the CASW. And so it was a Latino family. So it was the patient, his wife, the three kids were there, and then there were some extended family siblings from the patient with cancer. Uh, and in the CSW, she went to the house of the client, and they were having conversations about, why is this happening and how is it metastasizing this quickly, and all the concerns that they had. And the CSW, as a good CSW, on things that are medical, she was like, well, we can go back to the hospital, or we can do like a three-way call and ask the doctor on those questions. But one of the things that she stressed was the idea of like the screening. Um, After doing the screening, it was a brother of the patient and two of the kids of the patient who actually had early stage colorectal cancer as well. I will say the patient ended up passing away because it was basically too late. The cancer metastasized in different parts of his body, and they couldn't control it. But the two kids and the brother, they survived. The brother had to undergo surgery, and it was very challenging. the doctors were saying, have we waited 3 months more, probably we wouldn't have been able to save it. And seeing this family acknowledging that if it wasn't for the CHW, that probably they wouldn't have done it because they didn't know about it. It's just very important. It's very important to stress this again and again, and without pushing, with a lot of respect. But if we don't do that early detection, it's an issue. We are leaving people that, might be already dealing with cancer and they don't know it. Needless to say, the CSW had to do a lot of like groundwork with them, and they didn't have transportation. Uh, the kids, the two kids that got cancer, they had a social security number, but the brother didn't, so the process had to look like different. Um, so it's a lot, but at the same time, you as a community health worker can do a lot of work there and having those important conversations with the family members when they are supposed to be happening. And all that also comes down to self-care for you as a community health worker. Uh, there is a program, and don't quote me on this, I think it's New Mexico, where they had two CHWs, and those two CHWs were working in the cancer center. Obviously, not all the cancer diagnoses end in a bad way, right? So thank God, many of those have like a positive outcome and the patient recover and they can consider themselves cancer survivors. Um, I actually have seen cancer survivors become community health workers as well. But because of the stressful situation with some of the clients, sometimes it can take a toll on the CHW. You might go home and you might still be thinking about your client. It's like, gosh, they just got this diagnosis now and they don't have money to pay for it and how they're going to do it. And so it is very important that CSWs are fresh to keep working with the clients. And if we don't take care of ourselves when dealing with cases like that, the next day you're going to be exhausted and you're not going to be giving your 100% to the next client that is in front of you. So that's a challenge. This is also a shout out for the supervisors to check in on the CAWs because I have seen that happening as well, where it's not all about the caseload and how many patients and how many goals. It's about how the CSWs are feeling and how are things going for them. Because even beyond the patients with cancer, it might be that there might be other challenges for that CSW. Kara.
Oh, nope. I was just coming on because we
Oh,
are almost at time. So wanted you to, yeah, finish up what you need to, and we can save room for questions if we have it. But thank you.
thank you. That's perfect. So diversifying the caseloads, trying to avoid the situation where you only work with cancers with patients with cancer. Uh, assessing peer and supervisor support is very important. Just giving them access to it, and then for you as a CASW, use management strategies like mindfulness, exercise, journaling. Take care of yourself. Really take care of yourself because that's important. I have seen CASWs, and what we are trying to prevent here is the burnout because of the type of caseloads that we work with. Okay. And so, just last but not least, I just wanted to just bring it all together again. And so, remember that the caregivers, they're focused on their own loved ones. They're going to neglect themselves. They're going to neglect their health. So be there as the CSW to poke on their shoulders, ask those questions. How are you doing? How's your health going? Timing and empathy is essential. Timing is never late. Remember, it's never late to ask for that screening for the family members. Balance and support for you as a CSW. So the balance of support that you provide to the clients, but also empower them to become more self-sufficient. Embedding the screening really works. So please consider that if it is not done on your organization, just make sure that you might want to have a conversation with your supervisor and ask, how will this look like? Can we do this? Can we add these questions to the screening? And then please, please take care of yourself because you are very important. All right. So I'm just going to leave it there. Kara, back to you.
Wonderful, Tone. Thank you so much. We're at time, but if there's a question or two, please feel free to let us know and we'll have sure Tone answers it, or we'll send you an email tomorrow, so feel free to send it in there. There was a question that had come up, and sorry, Lizzie will be putting some of our CSC resources in the chat there, and there's some on the screen. There was a question that came up, and you spoke about it a little bit, but just how to kind of tailor your conversations with, to make sure they're culturally adaptive or culturally responsive to the person you're talking about. So we're thinking, race and ethnicity or age. Is there anything that you do or think about kind of when you're having those conversations, and how do you really tailor it so you're meeting the person where they are?
I always say the same thing to my CSW, since just first being aware that you might be working with somebody that doesn't have your same ethnicity, your same race, your same beliefs, etc. Ask questions. It's very important that we ask questions. Hey, I see you doing this. What is that for? You know, and then never assume. When you ask the questions, even if they take it wrong, you apologize and you move on. And it's like, okay, I've learned something new today. Thank you so much. I have and this is current, I have a client from Bolivia who, this is gonna sound a little bit gross, but he has a glass container with sand and rocks, and he has crickets. And he eats a raw cricket every morning. And when you ask him, like, why are you doing this? He's doing it because he thinks that for his health, he's gonna be healthier. And I am no one to question that. So, and the last thing that I will say is language. So if you're working with somebody that their primary language is different from yours, just make sure that you ask, like, do you feel comfortable having this conversation in English? Because sometimes we try to be there in the society and get to the same level that somebody else is. And even if our English is down here and but you're not understanding everything. So given the possibilities, like, do you want an interpreter? I'm more than happy to do that and help you. So there is so much. I could talk for hours about that, but I'm just going to leave it there.
No, thank you so much. I appreciate that. And one last question that had come through is, and I think this is true for cancer patients as well, but sometimes there's just so much, you're in this waiting period of not knowing of, you had a test or you had a screening, and now you just kind of have to wait. So I'm curious as to, what kind of supports you might give or what you might say in that situation.
Uh, One of the most important things that the CSW can do at that point is to be an ear, to listen to the client, to listen to the family member, uh, and then connecting to the resources that they need. It is tough waiting, and it is tough not just for the family member and for the patient, but for you as a CSW. It's it's challenging because you know that depending on that result, things are gonna go this way or this other way, and so just being able to be there. And I am gonna say this, and we encourage this with my program. That doesn't mean that all the programs encourage this, but it's not the first time that if I'm having a conversation with a patient, I put my hand in their shoulder or a family member and it's just grab their hands and say, look, we're gonna do as much as we can here. Never promise, don't say everything is gonna be okay because you don't know that. But just making sure that you are that ear and that support that they need right in there.
Thank you. And sorry, one last question that came through at the last minute.
Sure.
Have you seen any success with CHW billing for your service in your area specifically?
That is a great question, and that is one of the topics that I'm working a lot. So, in Kansas, I've been leading the effort for Medicaid and Medicare reimbursement. Medicare is at a federal level, at a national level, so hospitals can access Medicaid reimbursement. For Kansas, we got Medicaid reimbursement. So I have been working with patients that do have cancer that got Medicaid, and then we get reimbursement for the work that the CHWs are doing, but not always. So check on your state, see what's the status of Medicaid reimbursement, and see if the providers that are seeing the client are billing for that.
Wonderful. Well, thank you, Tone, so much. And to all of you who attended, we really appreciate it. Again, we'll send out all the resources we mentioned, all of the recording and the slide deck and a survey to you all. But again, just thank you so much. We really appreciate it. And Tone, I was truly inspired by your talk, and thank you just so much
Thank
for
you.
being with us.
Thank you. We are here for that. So anything that you guys need, I'm happy to chime in again.
Wonderful. Thank you, Tone, and thank you, everyone. Have a great rest of your days. Appreciate it. Take care.